Good day, everyone. I'm Dr. Marilen Abueg, a pediatrician practicing in the province of Cavite. In celebration of the National Newborn Screening Week held every October, I will be giving a talk on the importance of the newborn screening program. First, what is newborn screening? Newborn screening is a simple procedure to find out if your baby has a congenital disorder that may lead to mental retardation or even death if left untreated. It has been an integral part of routine newborn care in most developed countries for 5 decades. Through newborn screening, early diagnosis and initiation of treatment, along with appropriate long-term care, help ensure normal growth and development of the affected individual. In the Philippines, it has been available since 1996. What are the objectives of the newborn screening program? The newborn screening program aims that by 2030, all Filipino newborns are screened. It also aims to strengthen the quality of service and intensify monitoring and evaluation of newborn screening implementation. It also aims to have a sustainable financial scheme and to strengthen patient management. The newborn screening program targets to include all Filipino newborns nationwide. In 2014, the DOH Advisory Committee on Newborn Screening approved the implementation of the expanded newborn screening program, which increased the screening panel of disorders from 6 to more than 28. What problems can be detected by newborn screening? As I've mentioned earlier, the newborn screening originally detected 6 disorders. These are congenital hypothyroidism, congenital adrenal hyperplasia, phenylketonuria, G6PD deficiency, galactosemia, and maple syrup urine disease. The expanded newborn screening, on the other hand, detects disorders such as amino acid disorders, endocrine disorders, fatty acid disorders, organic acidurias, thalassemias, hemoglobinopathies, urea cycle defects, among others. Now, why is newborn screening important? Newborn screening is essential for the early identification of disorders in newborns. It can also detect disorders that cannot be identified physically because most babies with metabolic disorders look normal at birth. By doing the expanded newborn screen, metabolic disorders may be detected even before clinical signs and symptoms are present. As a result of this, treatment can be given early to prevent consequences of untreated conditions. When is newborn screening done? Ideally, it is done immediately after 24 hours from birth. Timing is essential in the management of metabolic disorders because death could occur in less than a week after birth. For example, in congenital hypothyroidism, the best time to treat is before 2 weeks of life because if left untreated, severe growth retardation and mental retardation could occur. On the other hand, in G6PD deficiency, the most common condition detected in the panel of disorders, trigger agents should be avoided. Trigger agents for hemolysis should be avoided in order to prevent kernicterus and hemolytic anemia. With regards to preterm, low birth weight, and sick infants, they should have their newborn screening done immediately after 24 hours of life unless blood transfusion is to be performed, in which case newborn screening should be done before the transfusion regardless of age. In addition, repeat newborn screen shall be taken at the 28th day of life. Babies discharged prior to the 28th day must be recalled for repeat screen. How is newborn screening done? Newborn screening is a very simple procedure wherein a few drops of blood are taken from the baby's heel. It is then blotted on a special absorbent paper, filter card, and then sent to the newborn screening center. The blood sample for the newborn screen can be collected by any of the following. Where is newborn screening available? Newborn screening is available in hospitals, lying-ins, rural health units, health centers, and some private clinics. It is relatively affordable at 1,750 pesos. It is also included in the newborn care package for PhilHealth members. What is the newborn care package? It is a PhilHealth benefit package for essential health services of the newborn during the first few days of life. It covers essential newborn care, expanded newborn screening, and hearing screening tests. Who are eligible for the newborn care package? Newborns are eligible for the newborn care package if either of the parents are eligible to avail the benefits, if they are born in accredited facilities, and if services were availed of upon delivery. How can results be claimed? Results can be claimed from the health facility where the newborn screening was availed. Normal results are available after 7 to 14 days after the samples were obtained. A positive newborn screen are relayed directly to the parents. That is why we should always ensure that the address and phone number you will provide to the health facility are correct. How are results interpreted? A negative screen means that the newborn screen result is normal. A positive screen, on the other hand, means that the newborn might be brought back to his health practitioner for further testing. We must remember that a positive result on the newborn screening panel is not a diagnosis. After a positive screening result is obtained, confirmatory testing and/or definitive consultation with a subspecialist is required before a final diagnosis can be made. What if the baby has a positive newborn screening result? Babies with positive newborn screening results must be referred at once to a specialist for confirmatory testing and further management. What happens to the dried blood samples after screening? After the dried blood spot has been tested, it will be stored in a secure locked area. The stored sample may also be used for research. We should also note that long-term follow-up and management of children with confirmed newborn screening condition ensure that these children receive full benefits of early identification through newborn screening. We should also remember that we pediatricians play an integral role in the management of children with confirmed newborn screening results. The primary care pediatrician serves as a central source of education for parents regarding multiple aspects of the newborn screening system. We pediatricians should communicate results of testing to families, provide counseling about the meaning of a positive result and the significance of the suspected condition, ensure that the confirmatory testing is performed, and to share the results of the confirmatory testing with families. We should help families navigate the healthcare system through appropriate referrals and to monitor the health outcomes associated with the condition throughout childhood. So we should save your baby from mental retardation by doing newborn screening. Ask your doctor about newborn screening today. I will end this presentation with a quote from Ida Lishan. A new baby is like the beginning of all things, wonder, hope, and a dream of possibilities.